so much for joining us for another weekly Q&A. I know I get really excited about these, but you can't blame me because I get to talk to people with fancy titles and letters after their names, and that's who we're talking to today. I wanted to introduce you to Amy Thompson, and these are all the letters, and she's going to have to explain it. First of all, she's the Cancer Survivorship Programs Manager for the Nevada Cancer Coalition, which is an organization that I have decided I love. And I've seen the things they've done here, so I'm really excited about that. But then there's all these letters. She's an RN, an OCN, and then something that a CN-BN, which what in the world does that mean? Explain that to me.
Well, thanks for having me. Wow, all those letters. They're not as fancy as they seem, I guess. Registered nurse. The OCN is an oncology certified nurse, which is an extra certification.
Wow, that's actually lovely. That's good to know. Thank you.
Yes. And the other one, CNBN, is a certified nurse, breast nurse. So it's with a national consortium of breast centers. Basically, it's that I was a breast nurse navigator for several years, and that was a certification that I got so that I had that extra layer of knowledge and hopefully confidence for other people that I would be able to help them. So that's what all that means.
So this might be a ridiculous question, but I do not mean it ridiculously. I mean this wholeheartedly and seriously. How in the world did we end up with you? That's what I mean, like, oh my gosh, I've never even heard of such things. And I work for a breast cancer organization. Mind you, I've told you before, I don't know much. I learn slowly as I go. But I mean, how did you end up here? How did you end up with Nevada Cancer Coalition? Are you from Nevada? You're like, I got to be in Nevada? I mean, like, tell me.
Yes, I'll tell you all the things. I think I am a rare breed in the sense that I was born in Nevada, which is kind of crazy. I don't know how many of us are still here, but I was born and raised. I moved to Las Vegas for a little bit. So I was born and raised in Reno, moved to Las Vegas for a bit when I was older, and then came back. So Nevada is my home. It's where my family is. I just love it here. So that's that about me. I have been an oncology nurse for about 9 of the 10 years that I've been a nurse. And I really just feel passionate about the world of oncology and cancer. And I mean, honestly, I don't think I've ever met anyone that hasn't been touched by cancer in some way. I mean, we all know and love people that have been affected by it. And it was just always one of those things that I thought I wanted to be a part of, to be able to give back. And I will say from the beginning, it has felt like home to me. So I was a bedside nurse in a hospital, and then I transitioned to be a nurse navigator, as I mentioned, specifically for breast cancer patients at a local hospital. And through that is how I got involved with being a part of Nevada Cancer Coalition as a navigator. Because again, I loved the idea of being able to network with other like-minded people and kind of really dig into how we help people dealing with cancer and the challenges that they face. And then I needed a bit of a change too. And what was that next step for me? And really looking at the community level was really what I was going for. So I was blessed to be able to get hired on to the coalition. So I joined them just a little over a year ago already to come over as the Cancer Survivorship Programs Manager and Patient Navigator to really build and oversee the program Thrive NV that we're going to talk about today. So that's probably more than you wanted to know about me, but that's...
Actually, I got a million other personal questions that I will ask you later, just because you know, I've known about you for a long time, right? And we've been on numerous Zoom calls together, but I don't think you and I have ever had an extended conversation just about life, which I find fascinating because that is the antithesis of who I am. My friends laugh because I can walk into a restaurant and within 3 minutes have the entire life story of the waitress or waiter that is assisting us, because that's who I am. And I'm just like, wow, I don't know anything. And don't take this the wrong way. You're impressive. You know, I mean, I know that's not your goal. You're a lovely human being, but you're also kind of impressive. I have no idea. I get excited, like I said. You know why I'm excited is Nevada is such an interesting, tough state in terms of reputation, right? There's definitely a set reputation about Nevada and the people that are in Nevada and the people that live here. And really, we are a community and we are trying to just help each other. And we'd love to cure cancer, right? I mean, love to see it go away. Hate to put you out of a job, but that's what I'm working for. Yeah.
I would gladly not be in a job. I think any of us working in cancer would say, okay, we'll find something else if it meant that, you know, that no one had to deal with this again. So
yeah, exactly. And that's kind of how I feel. That's my philosophy. But I feel bad that I didn't appreciate how spectacular you were. And
oh my goodness, no, it takes a village. My goodness, you know that. I really do believe that. I think we all have something to offer, and we're all on our different journeys. And I mean, it takes years for any of us to kind of get where we are, and we're never going to know everything. That's not the point. That's why we all have each other. And that's another thing that I love about the coalition, and like being able to work with you and meet you. And I mean, you're in Las Vegas, I'm in Reno, but as the coalition, we span the entire state, and being able to get connected even in this crazy last year that we've had,
right.
You know, the silver lining of that is being able to have these types of conversations where we wouldn't be able to do this otherwise. And we've been able to meet a lot of really great, passionate people. And I'm hoping as a state, with all that we're trying to do together, we're just going to help even more people, which ultimately is what we all want to do. So
exactly. And that is actually why. So I was in a Zoom meeting with you and a handful of other people across the entire state. And I want to continually stress, we deal with the entire state. I'm not leaving anyone out. I know you guys don't leave people out. So so that's what this is. It's an entire state effort. But so I was in this Zoom meeting hearing about something for the first time. And I was like, one, I probably should have known about this already. How unattached am I? But number two, I was like, I don't fully connect with what you're telling me, although I think I do. So I wanted to have you back because I want to talk about the very overall idea for Thrive NV, like the whole, and then I might want to talk specifically about as it applies to breast cancer, and maybe a few other questions that I have, especially about the state of Nevada and that program that they have and how you guys connect. Can you see where I'm headed now? I'm like, I'm spewing, which I feel bad about, but I also am just like, my mind is going, like I told you earlier, it's going a million miles an hour about Thrive NV and what I think it is. So I just want you to set me on the right path. Thrive NV is that your idea? Was that something you presented, or did you hear about it someplace else? Let's start there. Like, what is it? Where did it come from?
Yes, good question. So no, it was not my idea. I cannot take full credit for that at all.
Credit. Yeah.
No, it has kind of been a long time coming, honestly. It really started initially from a survivor focus group study that the coalition did quite a few years ago. Okay. And really from that information, we heard from people across the state, including caregivers, about what some of their barriers and challenges were that they were experiencing. And really coming out of that focus group were some pretty consistent themes where people felt like, you know, they maybe didn't have as much care coordination. They felt that they didn't get enough information or resources, maybe not enough support. And that was for not only, you know, patients and survivors, but also for caregivers too. So what ended up happening as part of the coalition is taking that information and saying, okay, what do we do with this? And that's where the idea of coming up with this team approach. And then over the several months to this last year is what we've come up with Thrive NV. So it's gone through different name changes and whatnot. So a lot of people have contributed to ideas for it. So the meeting that you were talking about was the Survivorship Task Force, which is one of the task forces with the Nevada Cancer Coalition, one that I lead. And that was really kind of the heavy lifters, if you will, of trying to see all of this get across the finish line. So taking the information from that focus group study, kind of all of that work and input from the Survivorship Task Force, and aligning with the goals of our state cancer plan to kind of say, what do our people in Nevada dealing with cancer really need? Mm-hmm. So that's where it came from. And again, it's called Thrive NV. And really the idea overall is to address the screening and survivorship needs for Nevadans, helping provide cancer patients, survivors, and caregivers with increased access to patient navigation. So addressing that coordination and support piece, peer support, which is another thing that we're working on, and resources in general. So we recognize that we are here to fill a gap. We are really trying to address these needs for people who don't have access or have limited access. So a lot of it we've tried initially in the implementation of it is to focus on reaching out to rural communities, and even in our urban cities. I mean, we can have big hospital systems and there are still people who need help. So essentially we're trying to be that neutral place for people to call. And then as navigators, we can then say, hey, let's get you connected with these other resources and get them to that next right place, ultimately so that they don't feel alone. You know, no one asks to have cancer. No one asks to feel that they're not getting the information that they need. People are really scared. And we just wanted to fill that need and help them know that they're not alone. So that's really the overall premise of it. And as part of the Nevada Cancer Coalition, we have 2 full-time patient navigators as part of this Thrive NV program. I am one of them, and then we have Cassie, who is the other. I am, as I mentioned, the survivorship programs manager. Cassie is early detection program manager. So we oversee those programs as part of the coalition and all that we do. And then, you know, folding in our training and background with being patient navigators to create kind of that foundation and be the touch point for people calling into us to get help, if that makes sense.
Yeah. So actually, from my point of view, here's my thought process then is I wake up one day and I don't feel well. I go to my doctor and the doctor's like, oh, you have cancer. Would it make sense at that point for someone to connect with the Nevada Cancer Coalition? I mean, the Thrive NV program? Because they do have a provider. Now, mind you, I deal with a lot of people that don't even have providers. That's our next question. But this one is, you know, they have a provider. Does it still make sense for them to connect with you guys?
That's a great question. I mean, honestly, even if people have a provider, it doesn't mean they're not still going to have questions or that they're not going to feel, you know, that they leave their provider and have additional questions, that they just kind of want sort of a neutral person within the cancer community to say, hey, talk me through this. Or I was just given a cancer diagnosis and I was told, you know, we'll take breast cancer, for instance. Mm-hmm. I was just given a breast cancer diagnosis and I was told I'm going to be sent to a surgeon. I have no idea what's going on.
Mm-hmm. Okay.
There's a real big area there where people are really scared, and sometimes they need that extra person to reach out to kind of just talk them through that. Right. You know, who is this other doctor that I'm going to see? Why do I have to see them? Why do I have all of these people on my care team? Who are they and why do I need them around? Mm-hmm. Sometimes it's as simple as having somebody else talk them through that, mm-hmm. and for them to feel heard. I mean, let's be honest, we're all human. We all need to feel heard. We need to feel cared about. and people dealing with a cancer diagnosis, they are no different, and they need a little extra time too. And that's where navigators, not just us, but other people across the state that do what we do, that's really the idea of a patient navigator, is to be there to help educate, connect people to resources, help them advocate for themselves, and again, let them know that they have these helping hands along the way to get them to where they need to be. So yes, even if people have a provider and a doctor, it doesn't mean that they can't call us. We're an extra level of support. If it's just for one quick question, or, hey, I need to know where to get a wig because I'm going through chemo, or whatever it might be. I mean, those are the kinds of things that are pretty easy for us to be able to be there to help if we can.
Right. So let's go the other way, because, this is the hot button that we all deal with, and especially in Nevada right now, is how many people who don't have insurance. And I run into it way too many times in a day. And I'm just trying to get better and better and better at what I can do for that segment of the population. And a lot of it has to do with maybe even living in the outlying areas. So I guess let me ask you this question first, because again, mind, million miles. If, let's say, they live out in the very, very rural areas of Nevada, where we know not a lot of doctors, definitely not a lot of major hospitals, and they're all of a sudden, nothing is necessarily wrong, but they have a moment where they're like, oh my God, I'm alone. Can they pick up the phone and talk to you, and you can point them in the right direction?
Yes. The quick answer to that is yes. No, you're absolutely right, because there are so many people going through so many challenges, and especially, again, I keep saying this, but after the year that we've had, there's a lot of issues that people are trying to balance on top of having a cancer diagnosis or being a caregiver of someone with cancer. So there's a ton that people are trying to juggle, and they just need somebody to talk to. So they may have lost insurance, or maybe they have insurance, but they're uninsured, or, there's all kinds of different situations that people are going through. And, none of us have all the answers or the crystal ball, magic wand, whatever you want to say, to make it all go away, because God knows we would. But again, being able to have the relationships that we all have within the coalition, and just us, and other partners that we have across the state. If I get a call from somebody and I'm not necessarily sure what resources to connect them to, I find out as much information as I can about them. And I say, I'm going to reach out to my peers, and I'm going to, put more brains together and figure out what options there are. And that's what I do, because again, we can't know everything, and leaning on each other is the important thing. And it's a lot easier for us to do that than to be expecting these people who are going through so much to do it. So that's kind of the approach that we take. It's like, we may not know it all, but we have a lot of friends and partners out there that have expertise in a lot of different areas, and I will reach out to them for that. And I've done that already with people in rural communities. And sometimes they just need that extra person on their side to know that you're helping, look out for them. If people need, some of their appointments coordinated because they're traveling long distances, things like that. So we can work together, again, as kind of a team approach within this program to ideally connect people to the resources that they need to help them overcome some of the barriers that they're experiencing.
Right. Actually, that is one of the things that I've had a conversation with many of my counterparts in various areas is, I would much rather have to make the 35 phone calls to figure it out than to make somebody who just was diagnosed with breast cancer and is like, oh my gosh, what am I doing? Have to make those 35 phone calls just to figure it out, right? Then the upside of that situation is, now you and I will both know what the answer to that question is the next time, right?
Absolutely. So true. And you know what, to that point, we learn so much from the people that we serve. And I'm sure that you agree with that too.
Absolutely.
The people that call us, if it's every one of those calls that we're not quite sure. And it's like, okay, you know what, let me reach out and find out. We're learning, which then is just helping someone else. And again, when I try to encourage people too, hey, if we're both kind of looking for something and I'm coming up short, but you find something, please tell me, because I can help somebody else.
Yes, exactly. That's why I get excited about learning these things, because then I'm like, hey, you know what? Here's the 5 things that we do at Susan G. Komen, Nevada. I don't do what you do. I'm not an RN. I'm definitely not an oncologist nurse, right? Like I mean, it just makes me more relaxed to connect people. One, you're a fabulous human being, but I'm just saying, when I pass someone along to you, I can feel good. Uh-oh, hold on. Oops, that was my alarm, so I could get up and walk every hour on the hour and get up and do my walk. Hey, I'm trying to stay healthy, not get blood clots. You know, I'm just trying to focus on my health. Since I'm doing this, I'm like, why not? But I like the idea that we're all connecting together. And in that meeting that I was in for the survivorship, there was doctors on that meeting, right? And there's other cancer nurses and there's other organizations. And I went, this is something that we need to definitely be connected to, so that I can connect our citizens to it. And that's, I think, what other people are thinking. That's why I really liked the idea. And I love that Nevada is doing it, because
yes,
we have this interesting reputation. As I have said, I have people, you know, I'm sure people have said to you, you were actually born there? People live there? Yeah, we live here. So, okay, so let's talk just for a brief moment then about underinsured, which for different people has a different mentality. So one of the questions that I've had, and I don't know that you have the answer to this, so please don't feel like I'm putting you on the spot, but I'm going to give you a scenario that we deal with every day here at Komen, and that is, I have insurance, but I'm only 32 years old and my doctor will not refer me for a mammogram. What do I do? Do you have advice for that person? Are you allowed to advise them? Are you allowed to, what do you tell them?
Well, in that situation, I mean, there's a lot of questions with that, because of course we know that kind of folds into a high risk population is where my mind goes to. If somebody under the age of 40 is asking questions like that, then my first question is, you know, are you high risk for breast cancer? Do you have a first degree relative that was diagnosed with breast cancer under the age of 40? You know, you start kind of, again, digging in a little bit more to get the information. Mm-hmm. If they are high risk and there's information that leads you down that path to think that perhaps that person does need to have a mammogram before the age of 40, mm-hmm. Then yes, you're helping advocate for her and help her understand maybe how she has to present that to the doctor, or what information she could talk about so that that physician understands that a little bit better. But it also could be the person not knowing when they should start getting screened. It could be, right. You know, there's several layers to those sorts of conversations. So, but again, if somebody under the age of 40 is asking me a question like that, I'm immediately thinking, well, why is she asking me that question? Mm-hmm. You know, is it a high risk situation, like I said, and then you need more information? Because generally, you know, if the first degree relative, like say if her mother had breast cancer, right. And her mother had breast cancer at the age of 45, and this person asking you the question is 32, well, she should technically get screened early, 10 years prior to when her first degree relative had that diagnosis. Right. So technically for that situation, that would be 35. Now, I would still be heavily advocating that individual talks to her doctor, whether that's the OBGYN or primary care, and make sure that conversation is very clear. You know, my mom had a breast cancer diagnosis at 45. I'm 32. I want to start talking about when I should start screening, what's appropriate for me, what kind of screenings should I get, you know, are there genetic testing components that need to be included, all of those things. So you're kind of in that space, helping somebody advocate and start the conversation with their provider.
Mm-hmm.
They are aware when they reach that appropriate screening age based on their own individual situation,
Mm-hmm.
that they're able to again, advocate for themselves.
Mm-hmm. And people don't have to be referred to you guys. You are available.
Correct. Absolutely. That's a really good question. Yeah. No, we don't rely on referrals from a doctor or from anybody really. I mean, someone can just call us up and we can try to help them the best we can, as we've said, and connect them to the best resource if we're not the one. They can visit our website, which we might be getting into as well.
Bring up the website. Yeah, let's talk about that website, because it's really easy to navigate and very clean, which I like. Do you guys have resources listed on the website, or is it definitely involve a phone call?
It's a little of both, honestly. The resources that we have on the website, we are trying to pare down to be kind of more support group and support service related. Again, just as a reminder, across Nevada, serving all cancer types. So I know we're talking, to more of a breast cancer audience today, but certainly, again, as trying to address the gaps across the state, we're addressing the needs of adult cancer patients, survivors, and caregivers of any type of cancer. So I just want to throw that out there too. Mm-hmm. So yes, we try to make that accessible to everyone.
Right. That's awesome. I really am impressed. I'm going to use the word impressed for whatever it's worth, about this whole arc that we've been on in this process, and just seeing when I stepped into it, just seeing, how together you guys already had it, and just to see how it grows. And I didn't realize, and this is something else, this is where I feel it's so important. I didn't realize even a quarter of the resources we have available in this state. So it's easy for people to get disheartened and overwhelmed. I could see why. Like when you're processing yourself through a medical system, it's not that they're bad. They want to help you. They want to take care of you. They want to get you better, but they're doing that to a lot of people. So advocating for yourself is really important, but you don't have to do it alone. That's why you guys are there. So what I can't believe is when someone calls, you're going to answer, like you're going to talk to them. It's going to be you and Cassie, whom I also love.
Oh, so do I. Yes.
Wow. Is there a plan to grow at all?
Yes, there is. But a little bit of background too, just some context. I mean, we just started this. I started, like I said, in March a year ago. So we kind of officially started the navigation portion in May. And then through the several months after that, we were developing the website and just, taking those opportunities to network in several meetings and just kind of let people know that we were available. And again, we're not trying to duplicate what other people are doing. We're trying to fill gaps and also be a resource to we've discovered even staff and social workers in some places. I have even talked to a social worker in Utah that was helping someone in Nevada that, sometimes the staff doesn't know some of those resources, or they've kind of gotten to the point that we talked about earlier. Well, maybe you've gotten to the end of what you know, and it's time to reach out. So it's been interesting because we have discovered that we can not only be a resource to the patients and caregivers themselves, but also to some of these other staff members and clinics as they help their patients. So it's been a really great experience over the months to kind of share what we're here to try to do. And again, this is a brand new program for Nevada Cancer Coalition, trying to address a need and really, again, collaborating with other partners to work on this together, not taking away from what other people are doing, but actually building on it. So we are kind of to the point now where, especially with the website that had just launched the beginning of this month, like what month are we in? The end of March already. It launched on March 1st. So it's now finally kind of that visual component where people have a place to visit and actually see what we're talking about. You know, they can access requests for navigation forms, whether you're a patient or a caregiver. So you can do it that way through the website or just call us. Finding out how to get signed up to become a mentor for the brand new peer program that we're starting.
Right.
So that's with a new partnership with Immerman Angels to provide one-on-one support. Or if people are looking for ways to connect, like we were talking about with the task force, people are looking at joining the task force or volunteering with the coalition. So all of those things are within the website space. So we're definitely in that great spot right now where I think people are going to start knowing about this program more, and we can truly keep getting it out to people and focusing in those areas of our state, as I mentioned earlier, in rural communities too, that really have limited access. Those are the people we really want to get this message out to them too. So again, this is a fight we're all in together, and people aren't left alone. So
wow, it's such an exciting time to be connected too, right? I mean, it's funny you said this when we started, and this is one of the first things that I thought of was I wouldn't be doing these weekly Q&As more than likely if it hadn't been for the pandemic. I don't know that I would have thought of it, right? Because necessity is the mother of invention, as they say. And I wish I could have thought of it without having to go through a pandemic. Trust me, I don't want anybody to be sick. I definitely don't want anybody to suffer at all. But it is that silver lining for me, because I feel this is a great way to help my neighbors learn about this wonderful possibility of just helping them navigate this medical health scenario that we have, which I appreciate, because, living in America, you really can't complain that much, but I do see needs like you do and gaps, as you say.
For sure. Yeah. And I think, again, we're all in that where we're doing this because we want to help people, and we want to help empower people to advocate for themselves and to empower them with education and information so that then they can pay that forward too. I mean, we're all touched by this in one way or the other. So I think that's the big take home of all that we're doing.
And we're both really young and have many years ahead of us. And, my plan is to survive, in a healthy manner as long as I can. And I learn a lot. So I did want to ask you one quick question. I'm sorry, I keep saying that. And on that phone call that I was referring to prior, there was some women from a state organization that now is like the Women's Health something or other.
Women's Health Connection.
Oh my gosh. I'm going to hunt them down and get them on next. But because that was amazing information that they had, and I know they're trying to do the same thing, correct? Is that available to anybody in the state, do you know, or is that only in Reno?
It's statewide. Women's Health Connection is access to healthcare is kind of the umbrella, and Women's Health Connection is specifically for breast and cervical cancer screening really, and kind of helping in that early part of the continuum. And there's definitely eligibility components that go into that, but that would be a great group to have on to explain how that works. I will say there are several clinics across the state that work with Women's Health Connection, and essentially it is a program that is helping, again, we say kind of fill these needs when people might be uninsured and needing to get filtered into programs to help them with their screening and diagnostic needs. So a lot of times it's a lot about piecing everything together, just depending on each particular person's need. Right. Not everyone is going to qualify for every program. And I'm, speaking generally now. So, just because if someone is underinsured, it again depends on what their situation is, what kind of cancer they have, how much they make, stuff like that. So absolutely. You kind of have to, again, that's where the partnering comes in, where we sort of lean on each other, figure out what that particular person's situation is, and then figure out, is this person, would this person be better served by, the Women's Health Connection, or are there, maybe some local foundations or grants available to help her with whether it's screening, diagnostics, treatment, living expenses, you name it. There's, as you know, there's the different sections that you're trying to figure out, again, what is going to best serve that person's needs. Yeah. So it's a bit of a puzzle, which is why it helps to have a lot of people to reach out to you. And I'm glad that, that you brought that up, that you learned that from that task force. And that's another really powerful thing about the task forces with Nevada Cancer Coalition. I mean, that really is the point, is bringing people, like I've said, those like-minded people together from, all different types of organizations. Like you mentioned, we have physicians, we have survivors, and I'm very passionate about having people from different voices, if you will, for a lack of a better way to put it, so that it really, represents kind of the spectrum. I mean, a physician can add their own input from a physician perspective, and then a survivor has a different input to add, and we learn from all of those things and say, okay, what do our people need in our state? Where do we need to go with this? Hence the Thrive NV program, hence like webinars, outreach, different sort of ideas like that. That's where that kind of stuff comes from, is having those task force meetings where you're brainstorming and people are bringing their ideas to the table and saying, well, hey, I have expertise in this, I'm willing to do this, you kind of piece it together.
Right. And I think that's one of the things that I wanted to stress that you've said, and I'm like, it's just so clear, is it's not one and done. So you may not qualify for this program, but then we're not going to tell you, sorry, see you later. Right. Got no time. And I think that's, people get so caught up, right, in the fact that it's so daunting for them. That's why I wanted to be clear. Like, it could be as easy as, yeah, you're not going to qualify for this access to healthcare thing. I've got something even better for you that's going to meet your needs in your cancer diagnosis better. And that's what is so amazing about the process, right? It's not just, yeah, there's this one opportunity. That's why I like that word coalition.
Yes. Yes.
And I've said this before too, because I'm the money side, right? I raise money. That's what I do. I raise money to fund our mission. I'm not the mission person. I'm not a doctor. I'm not even a survivor. Thank heavens. I'm sorry. But I mean, I've never had cancer. I'd like to keep it that way. but I raise money and I'm good at it. And I'm willing to put my reputation on the line to fund things like this, because they make a difference in our communities. And I think that's what's awesome. So there's people like me, right? And then those people that want to help fund that is great. And we need those people, just like I need the people who know how to research cancer in order to help eliminate it. So it's
Well,
exciting.
and that's how we were saying, everybody's kind of got their piece of the puzzle.
Yep.
And we're all good at our piece, and we come together and learn from each other and work together. I mean, it doesn't happen in a silo, and it shouldn't. So those are things that again, opportunities like this to share is wonderful. And I appreciate this. And I'm glad that you have been able to join the task force and learn. And I love that. That's one of my favorite things about working with the coalition is connecting people, networking, learning from people, and really kind of seeing those relationships happen and knowing that, every like group of people that gets connected for something is helping even more people. Yeah. So it's kind of this ripple effect. It's really cool.
Golly, gee willikers, right? I mean, it is amazing. It's so amazing and interesting to be even a tiny part of it. So I thank you for letting us be a part of it. I know it seems silly, but I honestly, it was why I get up every morning. Well, that and the girls, as you know. Yes. Those two cats, they get me up every morning. But just being able to see things like this. And then interesting for me is then seeing this model function well, which is what we're hoping for, right? There's a plan. We want to grow it. We want to see it function well. And then we go to Utah, right? And Utah, we're like, hey, here's what we did. And look how it's working. And let us show you how to do it. And then it just keeps going and going. And why would that be bad, right? That would be great.
Well, and you bring up a great point, because part of this is really, Nevada was one of 5 states chosen for a CDC grant, specifically improving the health and wellness of cancer survivors in rural communities. And part of that was what we built this program on. That was kind of the premise of how do we address these needs, and developing patient navigation was part of that. So it all really lined up perfectly with all of the background that we already knew, the needs that people expressed, as I mentioned in the survivor focus group study, and then having this grant opportunity to really kind of push us forward even more. And it's really exciting because, we're finishing up with that grant in terms of reporting, but obviously our work is just getting started with this wonderful program that we're happy to have in Nevada. But I'm excited because, who knows how many other states might be able to look at those of us part of this and hopefully learn from what we've learned and some of the lessons that we have, and to be able to apply that to their own state.
Yeah.
So, that was kind of a good segue into being able to explain that too, because I think that that's an important piece of this. And ultimately, I would love to see more navigators, and you don't have to be a nurse to be a navigator. There's patient navigators, lay navigators, community health workers, medical assistants. There's so many wonderful people in the community and in clinics and health centers that do this kind of work. So we all kind of have different names for what we do, but essentially you're there to help somebody navigate through the system, whatever that means to them, whether that's helping them get screened, get to their appointment, get to resources, help transition back to their primary care after they're done with treatment, and or helping caregivers. So I would love to see that this energy continues across Nevada, and that other centers will start to identify the need to hire more navigators, so that people can get access to these resources quicker. And again, the more of us doing this work, the more people that we can help. So that would be my magic wand again.
And that's why I'm thankful to have Dawn. Have you met Dawn? She's
yes, she's
Dawn
wonderful.
So Dawn is the navigator in our world, and Dawn's also a breast cancer survivor. So in my mind, it's not the only thing that makes her really good at the job, but it's definitely what makes her way better than me at that part of the job. And so I love having her around, and because she cares about people on that level, which, you know, that's a great thing. And that's why I'm very appreciative of all of us. I'm going to include myself because I'm not excluding, but I'm just saying I am appreciative of those that have been down the road and know what it's like and can help other people go down that road as well, if that's what needs to be done. So
yes, and such a great point, like opportunities to give back. I mean, we within the coalition are always you know, happy to have that. And as I mentioned earlier, starting a peer support program within the Thrive NV program, where we are currently starting to recruit mentors, whether you are a survivor or a caregiver. We are asking people to come to the Thrive NV site and register through our peer partnership with Immerman Angels to become a mentor. And again, the idea of that is the same concept, building this foundation of mentors specific to Nevada, so that eventually we can open it up to have that true peer-to-peer matching, so that somebody that lives in Elko or Las Vegas or wherever in the state, that if they're looking for someone that lives in the state or hopefully in their community, that the opportunity to be matched with them would increase the more mentors we have.
right.
So we're excited to be starting on that too. So not only trying to address the navigation piece, but also that peer support too. And again, it takes all of us working together to help connect people to those resources.
Yep.
So that would be another opportunity for people to give back. Because you're right, it's people that have been through it understand it in a way that the rest of us never will.
Exactly.
So,
exactly. Yeah. So, you know, I feel bad because I could keep talking to you because in my head I have like 10 other like random questions. But here's what I would like to do. And that is, you know, a year down the road, I'm going to hunt you down again for sure. And I want to revisit like where the program is, you know, what have we learned? I think that would be really interesting, is like, what have we learned from this process? What holes do we still have? It would be interesting to see a year from now what holes we might still have and how do we fill those. So it's kind of interesting that philosophy is we're literally just finding the holes and figuring out how to fill them. I do that on a daily basis, really. So that's something fun. My next door neighbor walks by and waves to me every time. I love it. So anyways, I can't tell you how much I do appreciate this. I have learned even a lot right now. One of the things that I want to reiterate is pick up the phone, just make the call. It's going to be easier to make one phone call to Thrive NV. And as much as I love all of our partners, or even us, I'm going to probably, John and I will do what we can, and then we're going to connect to you guys as well. And then we have resources that I want to make sure you're connected with that we also, in the state of Nevada, offer to our citizens as well, that doesn't require insurance or anything like that as well. So I want to make sure you have that list of our resources, which I will do right away.
I would love that. Yes. Yeah. And we do. I mean, like I was saying earlier, we have some resources listed on the site, but we recognize it's not an exhaustive list. I mean, it's so hard to be able to properly represent all of that and maintain it so people aren't frustrated by looking at a list that isn't updated. So we don't want that for people either. So but yes, we do welcome that, even to visitors of the site. If you recognize that perhaps there's a support group or a service that you use that isn't listed, that we have an opportunity for you to add that, you know, to reach out to us and add that. So we try to encourage people to help them add to this that way as well. But I would love whatever information you have to share, and then we can share it with our navigators and within our own navigator network too, to again help other people.
Absolutely.
So
I mean, that's why I'm like, the resources are there. They're there. So let's connect people to them. I would want to be connected to the resources that I need in my life. So why would that not be the same for someone else? So I'm in. We're going to make it happen. You and I are going to be stuck with each other for the next year at least, baby girl. So
Yay.
just live with it. Plus, Paint Nevada Pink is coming up, and you know how I feel about that event, right? I love it. I love Paint Nevada Pink. I love what I think it is capable of doing, which is saving lives, right? Early detection
Absolutely
saves lives.
That's where it's at.
Yeah. So
and again, it takes a village, a united front, a united message. Yep, absolutely. We're all about it.
Yeah, I'm very, very excited for the next upcoming months. I am very excited to be able to pass people on to you guys. I hope you're ready. I just feel that it's such a great resource, and I'm really excited. And I cannot thank you enough for joining me. And I love that you're here with me, and I will be seeing you again.
Oh, thank you so much for having me. I really appreciate the time.